This is because young children are prone to certain respiratory illnesses called viral bronchiolitis, which might cause lots of phlegm and congestion in the chest and difficulty breathing. And others might encounter proper pneumonias or chest infections, which might need to be diagnosed and treated. Hi, I'm Dr. Mohana. I'm a pediatrician and I work at Petite Practice. I have a subspecialty in pediatric allergy and immunology, in addition to general pediatrics. Common childhood illnesses encountered in the first few years of life usually are common colds, where you might have fevers, cough, runny noses, and the other most common illness is what we call childhood gastroenteritis, or more commonly known as the stomach flu, where you might encounter fevers with vomiting, tummy pains, or diarrhea. So these are going to be encountered fairly commonly in the first few years of life, and some children do fall ill with these illnesses back to back, even on a monthly basis. Hence, it's important to know what we term as red flags. So red flags are more serious conditions where you would want to seek immediate attention with your child, rather than just medicating or observing them at home with these common illnesses. When we speak about fevers, then fevers in infants less than 3 months of age, measured on an axillary thermometer, 38.0 degrees Celsius and above, is important to check in straight away. This is because these infants have much lower immunity and are more prone to bacterial illnesses and warrant checkups. For most other children who might be feeding and drinking all right and have fairly good energy levels even with fevers, then you would want to check in if the fevers are exceptionally high. So we usually don't encounter fevers which are 41 degrees Celsius and above, and if your child has a temperature close to that, you might want to check in earlier with a doctor. If the fevers are close to 39, 40 degrees, but they're feeding all right, but the fever patterns don't seem to be improving or spacing out by the 3rd or 4th day of illness, you would also want to check in then. For most other children, if the fevers persist and are above 38.5 degrees, don't seem to be settling by the 5th day of illness, then that's an indicator to check in. This is because most fevers and most viral illnesses do tend to progressively settle by the 5th to 6th day. For common coughs and runny noses, we are more concerned when the infection might be within the chest, and these might show up with difficulty breathing or fast breathing in children. Or if children are breathing fast, they don't tend to drink or feed very well. So if children are drinking less than half their usual fluids, they are looking more lethargic or breathing fast, do check in early with a doctor. This is because young children are prone to certain respiratory illnesses called viral bronchiolitis, which might cause lots of phlegm and congestion in the chest and difficulty breathing. And others might encounter proper pneumonias or chest infections, which might need to be diagnosed and treated. When it comes to vomiting and diarrhea, a common key is how much fluids you're able to keep in. So if the child keeps throwing up fluids repeatedly, then we will need to stop that to prevent dehydration, and you will need to see a doctor early. If the child is still able to keep fluids in and activity levels are fairly good, and they are continuing to pass urine relatively well, they're not dehydrated, you could opt to monitor for a few days longer. The same goes for diarrhea, because even if your child is drinking well and has excessive episodes of stool losses, watery stool and diarrhea 8 to 10 times a day, your child might be progressively getting dehydrated due to excessive losses. So if your child is looking very dry lips, dry tongue, more lethargic and not passing urine well within 6 to 8 hours, you don't get frequent wet diapers, then that's an indication to check in too.